nursing student. I am studying the Diploma of Nursing, and I just wanted to make a YouTube video to try and help other students that might be struggling, that are a little bit confused. Just like to be able to help other students that are a little bit in the dark. So I'll start with stage 1. I'm currently stage 2. This is also a little bit of a journey with me. Oh! Ow, I ripped my piercing. Don't have piercings. Do not have piercings. You're not allowed piercings. This? No. Vocational placement, you are not allowed piercings. Very, very strict on that. Especially in clinicals, like for Resi Week, don't take all that shit out. You can leave the nipple piercings in, but take everything else out. So, stage 1 OSCAs. I went into it not really knowing what the content would be, what components of our study would be applied to it. Does prepare you for the situation is being knowledgeable in your different terminologies. You really need to know, what am I doing with my hands? You really need to know your vital ranges. They will ask you, babes, you're gonna have to fire off those answers off the dome. Tachycardia, bradycardia, hypoxia. Essentially, I'm getting ahead of myself, for sake. I really want to get filler just under here because I've got like hollowed, you don't care. We'll be given a scenario. It's a role-playing scenario that you and another student will enact in front of the facilitator that is grading you. Vital ranges, how to conduct a pain assessment, how to introduce yourself to the resident or patient. I was on a wicket there. We will conduct this vitals assessment using your thermometer, oximeter, PEL. Pupils equal and reactive to light. You're gonna need to do a manual blood pressure on your patient. What level of progression is required for said stats, like obviously if someone's hypoxic, their saturation levels are at an 82, obviously that's an immediate like med call. If they're sitting at like 95, 94, you're not really going to escalate it to that degree. So there's variance in how you manage each situation, but that all comes down to critical thinking. Your critical thinking skills will trigger and you'll be like, okay, this person's hypoxic. They need air. God forbid I go without my pineapple flavored air for too long. Don't vape at placement. Don't vape. You will get in trouble. Your facilitator will hear about it. Do not vape. Do not wear your uniform if you are a smoker or you are a vapor. Take a jumper with you to cover your uniform. Take off your lanyard that has your name on it or whatever it may be, your physical ID. Strip that all off. Take off your uni scrubs when you go out for a smoke because the facilitator will find out about it and you will get reprimanded. Happened to a lot of people in my cohort. I was one of them. Anyway, OSCAs. Vital signs, vital signs, vital signs. Memorize that shit. You are going to need to know basic terminology, hemiplegia, dysphagia, okay? To know what a CVA is, cerebral vascular accident, how to differentiate between type 1 and type 2 diabetes. This is more in depth later into the coursework. However, I was asked about it. Good thing I knew a little bit about diabetes because I was put on the spot a little bit by it. You will have a lot of practice, a lot of clinical hours that go into performing these role plays. It's essentially the exact same thing. Vital check that matches the case scenario that you've got. Read it thoroughly. One of the students that I was with, just beautiful girl. She's so intelligent. She actually brought a highlighter. Every time she would get a case scenario to act out, she would highlight things, you know, the relevant information, like 87-year-old woman, hypertensive, presenting CVA, would highlight the key information, and then she would know everything that she had to relay just so she didn't miss anything. It was incredibly smart, but you don't want to miss that critical information that they will try and trip you up on. Your eyes are not deceiving you. That is a palm tattoo, by the way. It says hand in unlovable hand, but it's kind of like seeped out of my skin and it hurt way too much for me to ever go back and have it redone. So I just have to live with it. You're not going to get discriminated against for having visible tattoos. I have never personally been in a situation where I didn't get a job or I didn't get accolades that I deserved because of my appearance. The way that I conduct myself is very professional in a professional setting. So I've never actually had any issues with like being discriminated against or whatever, but I probably wouldn't. It works to side benefit. Okay, side rant. I actually have really good patient and resident response. They just absolutely love me. And it's because of the way I look. Without saying anything, they go, oh, you look very interesting. What does that say? Oh, I love that butterfly in your neck. Did it hurt? I have never had a bad response to how I appear. One woman did say to me, would you do that again? And I was like, no, I probably wouldn't. I was pretty young and pretty dumb. I'm 34. This happened when I was 33. Live and learn. And she was like, oh, you're a little naughty one, aren't ya? But I've never had anyone react badly to how I look. I've never had anyone decline being seen by me. I think it's all just how I represent myself. That is very crucial. If you go into work and you are very enthusiastic and you are outspoken and you are happy to be around and you're bubbly and you're a bit the residents and patients will absolutely love you. If you exude confidence, gives them the confidence in you that you can perform your tasks. If you go in and you are very, very insecure and very scared or timid, they're going to sense that. Just like every boyfriend you've ever had, just fake it. In there, hi, how's it going? Just do it and don't even think about it. People get too in their head about what they're going to say, how they're going to go through the sequence of what they need to do. Just wing it. Promise you it will work to your advantage. I promise you. In school, I did see some students were very nervous while doing role playing and stuff. I was just like, it. If I tank, I tank. If I do good, I do good, but I have to go in and just do it as organically as I can. I would just go in. I never paid attention to sequences. Obviously, you have to like introduce yourself. And hi, my name's X and I'm from X. As a student nurse, is it okay if I perform a set of vitals on you? Always ask for consent. It doesn't matter what you are doing, always ask for consent. I cannot emphasize that enough. Your facilitator, your teacher will love you for it. I always ask for consent because I want to make sure that person is comfortable in my care. And if they're not, I can find someone better suited for their needs. I don't want to make anyone uncomfortable. It's not what my job is. My job is to help people, but I have to help people that want my help. I have no idea what I was talking about. Oh yeah, so you're going to walk in, introduce yourself, identify them, get all that out of the way, and then you're just gonna wing it. PQ2RS. Never remember that. Pain, radiation, quality, time. That's the only acronym that I can't remember. The PTTQRS2. We don't talk. PQ2RS2 unfollowed me on Instagram. I just speak organically and I've never been reprimanded or told that it's negligent or inappropriate. Just do what works for you. After you've done that, you guys will switch. So the other student that you are performing the role play with will take over. They do a different scenario that they've been allocated. Wipe your utensils. If you are using the communal thermometer, oximeter, anything, wipe it with disinfectant after you are done because these are tiny little details the facilitator, your teacher, whoever's assessing you is taking notice of. It might not seem like such a big thing, but in the grand scheme it is because these are things that you need to be doing in reality. Implement it into your routine and it'll become second nature. But always focus on the little things. Ask for consent. Disinfect all the equipment afterwards, the call bell for your resident or your patient, make sure they have water or they have a drink or whatever they will need in arm's reach. Ask if they need anything else while you're there. These are little minor things that will make you seem like a adequate nurse in the eyes of your facilitator or precipitate, whatever. So you'll do that, it'll switch, the other student will go. I opted to go first because I'm one of those people that whenever there's something that needs to be done or practiced in clinicals, I always say, yep, I'll do it first because I think if I f it up, it's way less embarrassing because I'm the first person to do it than being like the fucking 15th person who's watched all these other people do it and f it up. I always go, yeah, I'll do it first. And that way I'm not sitting there or standing there stressed out, anxious as shit because it's my turn soon. I just get it over and done with. I recommend you all do the exact same thing. It'll make your life a lot fucking easier. I just got my hair done. I paid $500 to get my hair cut like that much. Oh, this has been a rude awakening, noticing what I actually look like. But at least my hair's pretty. Nursing school. So some people that do OSCAs are required to do neurological and neurovascular. However, that was not the case for my cohort. We did neurological and neurovasculars on residents at placements. Do this twice in front of your facilitator or in front of an RN that can document the fact that you've actually done it and performed it adequately to standard as a satisfactory level. The RNs and the ENs and your buddies relay information about what you have done throughout the course of your day to the facilitator. Facilitator is not going to be with you at all times during placement. They have better shit to fucking do. Everything that you do throughout the day, throughout your shift, is relayed to the facilitator by the people closest to you. They are not going to mince words. Okay? Be on your best behavior. Conduct yourself professionally. Do everything you can. You need to be able to perform tasks, ADLs, personal cares, feeding residents, assistance with hoisting, assistance with changing, assistance getting into bed, assistance mobilizing, ambulation. Do not, oh my God, do not even push someone in a wheelchair if you do not have your buddy or EN or RN with you. Shit can go sideways like that. You might push the wheelchair and your resident for some reason is just like, pulls clean out. That shit's on you. Do not do anything unsupervised. Is the most critical thing in your placement. Do not do anything unsupervised. It doesn't matter how minuscule it seems. Don't do it. One of the RNs told me to go give a blood pressure to a resident and I was like, hell no, bitch. I can't do this alone. That was a test. I wanted to see if you would work out in your scope of practice and you didn't. And I was like, you cannot be with a resident or a patient unassisted. Not for stage 1. This is where you find your footing. This is where you are able to work out if nursing is for you. A lot of people kind of tap out at this point. Go, nah, it's just sharing people and changing people's pads. This isn't for me. This is not why I want to get into nursing. And that's totally fine. ADLs are a big part of nursing. It is what it is. Have leather shoes. Get something with a lot of cushioning because you are going to be on your feet 8 hours a day and it will not let up in placement. Your feet will out. It is so painful. It is so painful, especially if you don't work a job that is so physically exerting. Like me, I'm a diversional therapist. I don't walk around 8 hours a day, but I did and it hurt. Full leather. Nike Airs do a really good full leather sneaker right now and you can wear them on the weekends. They look pretty mad when you're hanging out with the boys on the e-scooters. Like me. The band dildos is what we call ourselves. Clinicals, Resi Week, you will need to have leather full enclosed shoes. They will put you up on it. They will literally tell you, don't come back. You will get sent home. It's a needle stick injury hazard. Very integral you have leather because someone's going to on your foot. Hate to break it to you, but someone's is going to be on your foot. And if you don't have leather shoes, that is just going to literally seep straight through onto your foot for the next 8 hours. I'm sorry, babes, but that's just how it is. You got on foot, better be leather. So you can just get KFC moist towelette, just wipe it clean off. Otherwise you got on your foot. And no one wants on their foot. Unless you're into that. Look, I'm not here to yuck your yum. What you will need for your nursing kit. E-Nurse has some really great kits. I believe it's around $100. Get one of these. And like, how the do YouTubers do this? I see them do this kind of shit when I'm watching like makeup tutorials. Why is it not working for me? Because my head's too big. Is it? Oh, it's zooming in on my head. Stethoscope. Do not buy the Littman ones for $300, bitch. Get it from E-Nurse in a kit for like $100. This kit's mad. It's got little alpacas on it. When you're walking around placement and you've got your stethoscope around your neck like this, because sometimes they'll ask you to do a manual blood pressure. So you have to be prepared, babes. And then you've got your stethoscope. I can never pronounce what the these are called. Stigum. I just say manual blood pressure, babes, and no one's ever questioned me on it. Oximeter. Let's see how I'm voting. 115. 115 resting. 98 saturation. That's good. I am not hypoxic. I am tachycardic though. You won't need to buy one of these. They have them at your education, whoever you do your education through. You will need your own personal stethoscope and what else can I yap about? Placement. I did mine at a lovely facility. I had the best time. My buddies were like exceptional. Everyone was so sweet and so kind, so encouraging and just get in there and do it. And I was like, yeah, around, find out. And I had a really good experience. I know some people don't. It was so much fun. I woke up every day, 4 a.m, fully logged in, and I had the best time. I think I just spat. Anyway, make the most of your placement. Never go out of your scope of practice. They will test you. That's what they are there for. They are there to assess whether or not you meet the criteria that is satisfactory to being at the level of knowledge and the level of experience and comfortability that you should be at by the end of stage 1. They are doing their jobs. If you have no problems, if you present no issues, they won't be relayed to your facilitator. So just don't have any issues. I say with like 3 mental health diagnoses. I know the first few days, you're not going to know what the to do. You are told to shadow, which is incredibly awkward because you're just following around someone and they're like running, booking it this way, that way, getting their done. You feel like you're a fart following them around like a bad smell, but that's what you're there for. You're there for the first few days to observe, get to know what you're doing, what is expected of you, and then you will be implementing the practical aspects of that. So the components that you need to pass your logbook. Pass twice on all the components of the logbook. To do neurologicals and neurovasculars. You do this. Essentially, getting a gauge on the functionality of the patient or resident's brain function. Their physical response is the neurovascular. You're doing the push. Can you push up against my hands? Can you squeeze my hand for me? Yeah, those are equal. They both feel like they're at the same strength. That's good. Squeeze, whatever, has to be equal on both sides of their body. To ascertain whether or not they have hemiplegia, which is half-sided paralysis, which you will learn about when you are studying CVAs, cerebral vascular accidents. Neurological is, hey, you know where you are right now, just to assess whether they are cognitively responsive and they are aware of the happenings around them. You walk in and you go, hi, how's it going? Critical thinking. They responded, or they sat up when I walked in. They said hi. They're not in a coma. It's really not as hard as you think it is. I assure you, going into nursing was very, very overwhelmed, but this is something that I've wanted for a really long time. I'm very ambitious, dedicated to what I do. It brings me a lot of satisfaction, fulfillment. I love meeting people. I love helping people. This is what I'm destined to do with my life. Be ambitious, be cordial. Say you're in a hospital setting. You've got a wife who's been sitting by her husband for 7 hours or whatever it may be. If you've got a few seconds of time, just go up to her and be like, hey, can I get you a coffee or a tea? Are you okay? Is there anything that I can do for you? Do you want a blanket? It's a bit cold in here. Would you like a pillow for your back or anything? Because these chairs are kind of uncomfortable. Just take a couple of seconds out of your day to improve someone else's life. Just a little bit. That little offer, that is just a little bit of kindness that you've extended to someone who needs support and needs a little bit of attention. Your responsibility extends past just patients and residents. You owe the family, the support system, the network around that individual equal respect, equal treatment, equal dignity, equal care. They might break down, they might open up to you, they might start crying, whatever it may be. You have a responsibility to help that person. Use your critical thinking, use your empathy, be a good person, and it goes a long way. Nursing is not just about residents and patients. It is about their network. At least in my opinion. Could be wrong, but that's just how I operate. You're seeing people at their best and people at their worst. There are people in there celebrating the birth of their first baby, and it's the best moment of their life. But then you've got the juxtaposition, the polarizing side of things where we're working palliative care and it's a young adult. You must be professional, work accordingly, be sympathetic, be empathetic, be encouraging, be supportive, and care to the same degree for each and every person. You know, that's just my opinion. My goodies. Placement, if it's in an aged care, you will be exposed to confronting things. We had 3 residents pass in the 3 weeks that I was attending placement. I was not present for any of them. The students in my cohort even were present. The facilitator was amazing and offered them like support, like, hey, how are you coping with this? If there's anything I can do, let me know. That's what I'm here for. Your facilitator wants you to succeed. They have your back 100%. There is no right or wrong response. Don't ever feel like there was weakness, that you didn't just jump into action. Don't ever feel like you didn't just perform Dr. ABCD because someone's choking. Sometimes you will freeze. It's totally normal. You are a student. Do not batter yourself up for that. Just, be a good nurse. And you're going to be a good nurse, because I am going to help you as much as I can. If you have questions, if you have qualms, anything that is leaving you stymied, comment it and I will read it and I will respond in a video, or I'll respond directly to you. I don't care. I kind of just want to do this to help support other students, give you a little bit of insight into what you're getting into, the little tips and tricks that I've picked up on the way, intricate detail of placement and OSCAs and clinicals and all this other shit. So that's kind of what I'm doing here. God, is that a pimple? Am I getting a pimple? Oh, God. Fucking. Is that dry skin? No, that's moisturizer. I just hit puberty. How am I going to tell my dad? Just kidding. I don't have a dad. All right. Bye. You again. No, you missed me. So do all my exes. Just kidding. I also wanted to point out, really handy, have a little notepad. You can buy them from Shein or Temu for like $2 from Shein. Little notepad from Shein, Temu, whatever you has, dude. Have that. Keep it in your scrub pocket. Write down the things that you have done throughout the day that you can talk to your facilitator about later on. If you did BGLs, vitals, just write down little things that you're uncertain about, or things that you want to perform or get more confident. So you can work on that and then you can just tick it off end of the day. We also had to do verbal handover, so having that all written down is really beneficial. I was able to work with my buddy and be like, hey, these are the things I really want to work on. If you have any residents that need these requirements met, hit me up. You will need to sign things in your logbook. Everything needs to be in black pen. Do not up. And what else? We had a debrief with our facilitator every day, which usually took about half an hour to an hour. With our stethoscopes, just debriefing with the facilitator. Jail. Firing squad. Electric chair. Ew. Now I've lost my train of thought.